Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about cirrhosis of the liver. When I left off last week, I was talking a bit about the different problems that are associated with the bleeding and how we go about treating them and evaluating them, etc. Before I do so, however, I want to bring to your attention this textbook that I just wrote, The Art and Practice of Modern Clinical Medicine. The Art and Practice of Modern Clinical Medicine is a huge book. It's about 10 pounds in weight. It covers 136 chapters, 889 something pages. If it has to do with modern clinical medicine anywhere in this country or around the world, you're likely to find it in this book. So put your hands on it so that you could bring yourself up to date, whether you're physicians, a nurse, medical students, social worker, government agencies, etc., etc. There's a lot of material in there that can be of great value to you. I'm sure you know where to put your hands on this book. Clearly, it can be found in the local public libraries, etc., and wherever, of course, books are sold. Take a look at it. Uh, I want to share some statistics with you to give you an idea how bad the situation is really as it relates to cirrhosis of the liver. Worldwide, there's some 500 million folks with cirrhosis of the liver. In this country, 5.5 million folks have cirrhosis of the liver, and 2,500 people die every year from 25,000 people die every year in this country from cirrhosis of the liver. And worldwide, there are several million people who died of cirrhosis of the liver every year, not several hundred, but several millions. And the cause, of course, quite common, namely alcoholism. Alcoholism is the number one cause of cirrhosis of the liver. 50% of cirrhosis of the liver is due to alcohol abuse. The rest have to do with hepatitis, etc. Hepatitis B, in particular, the most common form of hepatitis that causes liver disease. Worldwide, there are 2 billion folks who are infected with hepatitis B, according to WHO. And every year, 1.5 million people die as a result of hepatitis B and liver disease. And hepatitis C, which is another common hepatitis that affects the liver, 170 million people are infected with hepatitis C across the world. 350,000 people every year die because of hepatitis C. As far as alcohol is concerned, some of the 7 billion people in the world, some 2 billion folks consume alcohol across the world. And worldwide, according to WHO, 140 million people are considered alcoholic. So this is major problem. And of course, all these things affect the liver, resulting in the liver being such a sick organ whenever it is abused either by infection or alcohol, etc. In this particular book, chapter 96 is cirrhosis of the liver. If you need more details and stuff that I obviously will not have time to discuss on the show, you could find them in chapter 96 of this huge book that I just wrote. I think this is book number 24 since I've been writing books. So let's get back then to what's going on. When I left off, I was talking about how one goes about evaluating somebody who's bleeding and what's the cause of the bleeding and etc. I get that out of the way. Now I want to talk about the effect of the blood itself once the blood finds its way. This is the this is the human liver right here. When one is bleeding, whether one is bleeding from the esophagus, which is very common, or one is bleeding from an ulcer, because peptic ulcer is also highly associated with cirrhosis of the liver. The blood inevitably is going to find its way down the large bowel. We humans have billions of bacteria of different types in the bowel that are there for good purposes, not for bad purposes, even though we can get sick from them, we frequently do. Because you see, the human body is separated in different compartments. For reasons that are multiple in nature, we wind up having these bacterial material from the bowel, bacterial organism in the bowel, find themselves either in urine, a bloodstream, etc. We get very sick from them. Okay, so but nevertheless, they're there also to provide good services. And what are some of the services? Well, for instance, we produce vitamin K. 10% of the vitamin K that we need to remain in good vitamin K level are produced. If the 10% is produced in the large bowel, that 10% makes all the difference in certain circumstances. For instance, if an individual is sick, and of course people are sick all over the world as I speak, and they wind up in a hospital, they're not eating, getting IV fluid, and sometimes they're getting antibiotics as well intravenously or by mouth. Well, the antibiotic they're getting kills the bacteria in the large bowel, thereby preventing them from producing that 10% vitamin K. And of course, they're not eating, and vitamin K happens to be very labile. The level is not very plentiful in the body, and suddenly the person starts bleeding. And then, of course, people go all over doing all sorts of fancy stuff, not realizing that the reason why they're bleeding frequently is because the vitamin K level is allowed to become so low because we're treating the individual with antibiotic, and somehow we forgot about that. We did not replace the vitamin K. Something that simple can cause major catastrophe, because when somebody is bleeding, they're already very sick, they have compromised organs, and now they started bleeding, they're dropping their red blood cell count, which is creating a major problem for them. They can develop cardiac problem, kidney problem, etc. And you don't want that to happen. Well, it's happening all the time. And this simple fact is frequently forgotten, and people wind up with major bleeding. They're already in the ICU, the CCU. They already have such significant problem, and suddenly all heck breaks loose, and crazy things happen. Okay, so once the blood then gets there, it gets broken down because blood has protein in it, and the protein gets broken down. There's a pathway we call the ammonia pathway that is located in the large bowel, and the ammonia pathway wind up finding its way in the liver, because ordinarily the ammonia in the liver is produced as a way of making amino acid and then making protein. Well, liver cannot handle that. Liver cannot handle the ammonia because the ammonia is produced here. That's where the production begins, and it winds up in the liver. Well, the liver cannot handle it. And that's where the two biggest problems that we're facing when the liver is very sick is bleeding and elevated ammonia level. And that's the big problem. Once the bleeding is taking place, it's inevitable blood is going to be found its way down here. The ammonia level is going to become elevated. Then we have a major problem in our hand. The patients started becoming very sleepy, very tired, somnolent, and suddenly the patient wind up in what we call hepatic encephalopathy, namely that the patient just goes into coma. Okay, so how do we go about that? Well, it's time now to begin to talk about treatment, which I began to talk about a bit last week. But this is the biggest mechanism that we have. We have to manage the patient's diet properly so that we keep he or she on a low salt, low protein diet. The patient has to make sure that he or she is getting sufficient nutrient so that the patient remains, if the patient is very sick in the hospital, they're to get hyperalimentation. We have hyperalimentation. We give the patient that doesn't have too much protein in it. We know how to do that. Okay, so the patient is maintaining in good anabolic state. Then as far as the patient who's walking around, who's not in a hospital, who has liver that's very sick, that's likely going to be failed sooner or later, same thing, control the blood pressure, make sure that the hematocrit is stable, platelet, white blood cell count. If the hematocrit is not stable, the patient sometimes has to be transfused. If the patient cannot tolerate the transfusion, then the patient has to be given Procreate or Epogen to try to stimulate production of red blood cell so that the patient maintain a good level of red blood cell level and so on. Pay close attention to these things. So that's how we do it. And of course, as it relates to other medications, the patients are likely to be taken either for diabetes or for blood pressure or whatever. Those medications have to be managed very carefully. The dosages have to be managed properly. The types of medications has to be categorized very properly so that the liver can handle them. Remember that everything that we inhale, everything we drink, everything we eat, subsequently find their way in the liver, and for the liver to process, get rid of the toxic part of it into the bile, and also into the urine to get rid of it. Okay? Now that we've done that, we got a liver that's beginning to fail. What do? Well, we have a medication we call lactulose, which is basically a medication we give to patients to help them to move the bowel several times per day. That's what the lactulose will do. But once you get the lactulose give patient frequent bowel movement to get rid of the excess ammonia that is being produced by the action of the bacteria in the bowel. So we use the lactulose as a first type of medication to try to keep the patient having a frequent bowel movement. Now, if the lactulose, of course, is not sufficient to do the job and the patient keep having more difficulty in spite of the lactulose, then we're talking about somebody who either needs to be hospitalized or the patient has to be given another type of medication. The one that is frequently available is something called rifaximin. Rifaximin 550 milligram, I think, is the dose. It is given to the patient 3-4 times a day to basically kill the bacteria themselves. Okay, kill the bacteria 3-4 times a day. And so doing, the patient is managed to do much better by killing the bacteria, and this medication eliminate the threat that exists because of the bacteria that's in the bowel. Because once the bacteria is in the bowel, is breaking down the proteinaceous material, and the liver cannot handle it because the liver is too sick. Okay, now we're talking about the next step. Once this is going on, now we're talking about liver transplant. Now that's another story altogether. I have some stat here for you that will be of interest to you as it relates to liver transplantation. Every single year, 6,000 folks in this country have liver transplant. Every year, 6,000 liver transplants are done in the U.S. And then worldwide, 21,000 liver transplants are done annually. Okay? Okay, so 6,000 liver transplants are done every year in the country. Worldwide, it's 21,000. Okay? Now, the whole concept of liver transplant is very complicated. I'm not an expert in the field. The whole concept of donation of organ is very, very crucial, and people all over the world have to get in contact through the action of the physicians to put them in contact. And first of all, you have to understand, by the time the liver gets to be so sick, these individuals are almost always under the care of a major gastroenterology center and a major institution, whereby they not only know how to take care of these patients as the liver is failing. I mean, I've taken care of them. I'm not a liver expert, but I'm taking care of them multiple times. But if the patient is willing, and I've already taken care of those who they don't want to have transplants, so I wind up managing them myself in conjunction with my gastroenterology colleagues. But ordinarily the patient would go to a major center. There are major centers throughout the country. There are many of them in this general New York area. And then, of course, these folks are superb at what they do, and the patient then have to be placed into a donor list, and then hoping and praying that she will get a match and get a donor so that they can get liver transplant. That is really, of course, the key component. And if the patient has hepatitis C or hepatitis B, these individuals have to be treated it goes without saying, they have to receive treatment. Those medications are extremely expensive. There are many of them all over now, all over the market to treat hepatitis B, to treat hepatitis C, but they are super expensive. They appear to be very effective, but they are super expensive, and it is an all-out fight sometime to get the HMOs, which controls everything having to do with expense these days, to pay for these things. Even individuals who have worked so hard, such as myself, who wind up with Medicare, and these insurance companies have also techniques on how to create what called Medicare Advantage, so as to take over the management of the Medicare of these individuals' policy, just because they control the 20%. The patient can't get any prescription properly unless these people approve it, and they can't get major procedure done in the hospital, etc., even sometimes on outpatient, until the Medicare Advantage people approve it. And this is a huge business. We're talking about millions and millions and millions of dollars that are involved. These people are very aggressive at what they do. They have tremendous support in the legislatures, local legislatures, as well as in Congress, to get people to allow them to do these things. I believe in New York there are 1.3 million, that's the number that comes from the top of my head, of people who are on Medicare Advantage. And the problem is, it is very difficult. Sometimes these are elderly folks. They wind up they sign them up for these things. These people most of the time don't know what they're signing for. And they have a whole year to get out of it. And even then, it's a war and a fight to get them out of it. And then they control everything. And it is, I guess people are making a living. I have nothing against insurance companies. They're just there to make a living. That's how they make the living. But those of us who are at the bedside every day practicing medicine, I can tell you it is a very, very difficult process to deal with these folks, to get them to approve things for patients who are very sick. And then when we are practicing medicine, the interference is intense. It is intense to get them to approve stuff for patients who are in need of these things. And that's an unfortunate situation. But this is, I have been in practice now. It's going to be 38 years of private practice. I practiced when HMO didn't exist, and I've been in the middle of it while the HMOs are in existence. The huge difference. The whole concept, the HMO, which I think I've written books and talk about these things before, the whole thing, the whole argument that put forth when these things were being created was the argument that they can help the government to save more money, and they won't tell you how many cents they can save per dollar, blah, 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 blah. It was all completely bogus. There was no truth to these things. And unfortunately, several of my retired colleagues who had already done very well in medicine, toward the end of their careers, they wind up being recruited by the insurance companies to help them, to let them inside the medical field as to what's happening. So for a few dollars that they were getting, because these folks have already made good living, some of them made lots of money. And that's how this whole thing started. I mean, I was here. I experienced the beginning of it. Started in the 70s during the Nixon administration. And I wrote books and discussed them. Again, I'm not against anybody. I'm just a journalist and a writer. And I'm telling everything that I'm saying to you can be found on the internet. Somehow, when I say it, it seemed to rub people the wrong way than when other folks says it. I don't understand that. I'm saying the same thing. Why they're getting upset when I say it and they don't get upset when other people say it, I'll let you figure that out. I'm saying the same thing. I'm just not making this up. I don't make up stories. My own personal experience, I mean, it has nothing to do with it. I mean, I've been a patient. I've been sick. I know what it is. I know what the expenses are. It is brutal when you're very sick. If you don't have insurance in this country, one simple illness, one simple hospitalization is enough to put you into bankruptcy. I do not understand, cannot comprehend, and I know a lot about human psyche. Why these people are fighting so hard to cancel the Obamacare is beyond me. I mean, it took so many years. It is not perfect, but it's the best that is out there so far. So many people had no insurance at all. When the Obamacare began, there were 52 million uninsured people in this country. 52 million. Oh, okay, now that has been cut back to significantly because of the Obamacare. It's not perfect, yeah. I would have liked to see a different system, universal health insurance for everybody, blah, 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 blah. But politics is compromise. So compromise was made, and all of a sudden, these people want to score political point, and they know nothing about medicine. Absolutely zero. They just talk from both sides of the mouth. Most of them have never sat on the bedside to take care of patients, and they want to eliminate it so that to make political points because they don't want the president to have credit for anything, even though he has done so much. So much. I can tell you so much. I read the newspapers. I listen to the news. I research. You go in recent history, President Obama has done more, most definitely much more than his recent, most immediate predecessors. He inherited a mess and tried the best he can to try to clean it up. But he doesn't want to get credit. They don't want to give him credit for anything. They don't give him credit. Well, I happen to know that he's done a great job. I only have one single vote. I only have one single opinion. And I happen to be a physician, and I know a lot of what's going on. Okay, so all I can tell you is the fact that credit is owed to him for having done such a fantastic job to try to create health care for those who need it the most, who have no insurance. So they're trying to get the Supreme Court to throw it out. Is a waste of time. It's not going to happen. It's not going to happen because he's done a great job. And I'm saying to, as a physician, speaking now as a health advocate, I've been a patient. Sure, I am pro-Obama, that's obvious. But also I happen to be a physician at the bedside. I have many people in my practice who have no insurance, and I continue to take care of them. They had insurance at one time, they lost it, and they're patients of mine. What am I going to do? Throw them out? No. I continue to provide care for them for no money. And it's okay. I never said anything. They just come in. I do what I can for them because I know they're men and women who have pride. They lost their insurance. They lost their job. Who am I to throw them out of my practice? I won't do that. I keep providing care for them, monthly, every other month, or whatever. I do what I can. I'm one single physician. I do what I can because I am a health advocate. I know what it is to be sick. So in any event, to try to ease this problem of cirrhosis of the liver, one has to begin to cut back on the effect of alcohol abuse, try to refrain from personal habits that can expose one to acquiring hepatitis C, hepatitis B, E, and D. Those things can lead to all these other problems. Some of these other issues are inborn, such as all the hereditary hemolytic disease. That's nothing one can do about it. That's what you pick up from your mom and dad. Nothing you could do about it, but you do the best you can. If you have other inflammatory disease that cause you to have your liver loaded up with iron. There's nothing you could do. Unfortunately, we have people who live in countries where parasite infestation is very common, because this book talks, there's a large section in this book that talks about parasitic infestation. That's the circumstances of life that these people found themselves in. Who am I to pass judgment on them? I live that life. I live in poor country. I live in Haiti. I walk barefooted for years, not for 1 year during vacation or something like that. I work on the farm for 10 years. 10 years, 8 o'clock in the morning to 5 p.m., barefooted, no clothes on my back, temperature 100 degrees or more sometime. I did that for about 10 years. You say, well, I must have been making a lot of money. No, I was making 1 good per day. And 1 Haitian good in those days was equivalent with 20 American cents. So for the whole week, I will make 5 good, okay? 5 good, okay? So, so 5 good was $5 for the week. I lived that life, okay? So am I not here to criticize anybody? When I came to this country, that gave me such a tremendous opportunity to be here to talk to you right now, I paid my dues, $1 an hour. $1 an hour for 3 years. And the factory is Goodman & Son, downtown Manhattan. And to get out of this mess, I had to go to school. So I worked 12 hours at night, went to school 6 hours a day. That's exactly correct. That's how I wind up getting into the school system. That's how I wind up subsequently in medical school, etc. So nobody gave me anything, just the opportunity to get ahead. So I'm not here to criticize anybody. I'm only telling you that I paid my dues. I wore the scars. I got sick with cancer of my throat because of exposure to junk that I inhale working in that stupid factory. So what can I tell you? So this is rough. This is the wind-up series on the liver diseases that I've done, which I've done 10 shows on cirrhosis of the liver. Next week, I'll find something next to talk about. Until such time, keep watching the show. This is Dr. Alcena saying so long and bye-bye.